Welcome to Cancer Newsline, your source for news on cancer research, diagnosis, treatment, and prevention. I'm your host, Dr. Oliver Bogler. Dr. Hayes-Jordan, recent research has defined subgroups of rhabdomyosarcoma based on molecular characteristics. What are these, and what do they mean for developing therapies?
Well, we've had some really fascinating developments in the last couple years on the molecular characteristics of rhabdomyosarcoma. And there are molecular markers that we know now are better predictors of prognosis than histologic markers we have used in the past. So PAX3, PAX7 are the fancy names for the genes that we're interested in. But when we find those in rhabdomyosarcoma patients, we know that the patients that have those markers actually have a worse prognosis than the ones who don't have those markers. So we are looking towards tailoring our medical therapy to the genetic components of the tumor in order to provide better outcomes for our patients.
And what are some of the current urgent clinical problems in treating rhabdomyosarcoma?
Well, rhabdomyosarcoma is a very rare tumor in children. There's only about 250 to 300 cases total in the United States annually. And so the Children's Oncology Group is collectively treating patients in the United States, Canada, and Australia, and now partnering with our European colleagues to develop new therapies in these patients. Because they're so rare, it's very important that we place all our patients under observation, which sometimes can be called a clinical trial. It may sound scary to some patients, but it's a way that we want to keep up with how the patients are doing and how they're responding to the newer therapies. This allows us to identify subgroups of patients who are at risk, who are not responding to our standard therapies. So the biggest challenges for us now are in patients that are not experiencing the 80 to 90% survival in rhabdomyosarcoma. So those are patients with complex parameningeal next to the spinal cord or in the base of the skull tumors, patients that have abdominal or pelvic rhabdomyosarcoma, and patients that have extremity rhabdomyosarcomas. Those are the ones that are having the poorest outcomes, unfortunately, of overall survivals of 50 to 60% compared to 80% or more in other areas of rhabdomyosarcoma.
Now, adults also get this disease, is that correct? And is it different in adults?
Yes, it's actually more challenging in adults because it's even more rarely seen in adults. So rhabdomyosarcoma in adults, for an adult oncologist, is very unusual. So we've been liaising with the pediatric oncologists so that we can come up with therapies that are unique. Adults with rhabdomyosarcoma, the tumors are not different, but because it's so rare, it often gets diagnosed late and in later stages. So because we diagnose it in later stages, the treatment becomes more challenging. In addition, adult patients respond different to the aggressive chemotherapy we give pediatric patients. Their bodies don't respond as easily as children do, and children can tolerate much higher doses of chemotherapy than adults can in most cases. So we are working with our adult colleagues now to develop specific adult protocols for rhabdomyosarcoma that take into account the chemotherapy and the sensitivities of the chemotherapy, but also take into account the ability of the patient to tolerate those therapies.
So it seems that the high-risk patients clearly need new therapeutic approaches. What's going on in the research area? What are the findings, and what are the opportunities to perhaps streamline research to make it progress more quickly?
What we need in research now in rhabdomyosarcoma is more laboratories working on basic science research and more laboratories with relevant clinical models, relevant animal models that mimic clinical behavior and clinical activity. We have a handful of laboratories, there are about 10 of them in the country, plus or minus, who are focused on rhabdomyosarcoma. But that just isn't enough, and we need more laboratories working on basic science approaches. What we really want to understand now is the microenvironment of the tumor. In rhabdomyosarcoma, they can be found in multiple different sites of the body, and they behave very differently in different muscle groups, even though the tumor looks the same or has the same genetic components under the microscope. For example, rhabdomyosarcoma of the eye has a 90+% survival. Those same cells in the pelvis have only a 50% survival. So if we can understand the difference in the microenvironment of the eye versus the muscles in the pelvis, then perhaps we can have some clues on how to tailor treatment in patients.
Dr. Hayes-Jordan, is there any role, do you think, for patients, families, caregivers in this collaboration that they could participate in?
Yes, the patients and families can really help a lot because the networks that parents and patients develop on blogs and various websites is very, very helpful. Because some physicians may not have all the information on rhabdomyosarcoma, so that the families can communicate that they've experienced a positive outcome with a clinical trial or a particular drug that they can share with other patients and families. That information can be given to the physicians who, in some cases, are not very familiar with rhabdomyosarcoma.
Thank you very much for sharing your knowledge and insights with our listeners. For more information, visit mdanderson.org. Thank you for listening to Cancer Newsline. Tune in for the next episode in our series.